Pulse, as defined by the Merriam-Webster Dictionary, is the regular expansion of an artery caused by the ejection of blood into the arterial system by the contractions of the heart. An individual's pulse plays an eminent role in that it is a significant indicator of the person's state of health. According to traditional Chinese medicine, or TCM, pulse is governed by a person's heart and commanded by their qi, or vital energy. The common location for pulse taking is just above the wrist, where the radial artery throbs. There are three main regions on the wrist that should be pressed on with 3 fingers in order to measure pulse: Cun, Guan, and Qi. Each region on each wrist reflects the condition of different organs. On the left hand, the Cun, Guan, and Qi correspond to the heart, liver, and kidney, respectively, whereas the right hand correlates to the lungs, spleen, and kidney, respectively. It was believed that there are 12 pulses on each wrist. Each of the 12 pulses correspond with a particular organ, and the different pulse qualities help the practitioner determine if there are imbalances in the flow of qi. Since there was no technology thousands of years ago, Chinese doctors and practitioners could only examine their patients through external methods: seeing, touching, questioning, etc. Pulse diagnosis, which would fall under the category of touching, could potentially inform doctors whether or not a female is pregnant, whether or not a person is haunted by a demon, or simply whether or not a patient has an illness or disorder. In Michael Strickman's novel, Chinese Magical Medicine, a more secular approach towards pulse taking is discussed. On page 244, it is said that, quote, differences in rhythm and recessiveness among the 6 pulses enable the clinician to ascertain whether the problem lies with a malignant creature, a haunting by a ghost or some demonic agency, or a combination of effects, such as a demonic ailment on top of a malignant haunting. End quote.
Though pulse reading is hardly used today, it still appears frequently in Chinese dramas set in historical times. Whenever a character in a drama gets sick, pulse reading is almost always used as a way to diagnose the patient. In this scene, the patient's husband calls the best doctors in the country to find a way to save her life, since she has been in a coma for a few weeks. After reading her pulse, the doctor stated the physical illnesses she obtained after falling from a great height. He also stated that the rare medicine needed, as well as the fact that even if she is cured, she'll never be able to have kids again. Here, after reading the patient's pulse, it was later stated that the diagnosis the doctor gave to the patient is that he is slowly losing his eyesight and may never gain it again. In this scene, the character is able to tell that the patient's blood is leaking into the brain and that he doesn't have much time left. In these scenes, the doctor's only form of diagnosing the patient was through pulse reading, no questions asked. For viewers who have no prior knowledge of pulse reading, it might seem like it was the only way of diagnosing needed, and complicated illnesses could be figured out in a matter of seconds just through reading the patient's pulse. There are scenes in other dramas that shows that pulse reading is not effective solely on its own, but also through a string of questions asked by the doctor. In this scene, the best doctor in the palace is sent to diagnose an ill woman who has been through many hardships. He starts by taking her pulse on both wrists, which is unique for dramas, since usually the doctor only takes the pulse from one wrist. In TMC, the pulse on both wrists is believed to contain different aspects of regions of the body, so it is important to take the pulse on both wrists. However, this is usually not used in dramas except for this scene. The doctor then asks her questions such as, "How has your sleeping habits been?" To which she replies, "Very poorly." Then he asks about her eating habits, which hasn't been well either, and has been having frequent stomach aches. He states that she has not been recovering well and taking well of her health after her severe illness in the past year. Then he talks about the state of her pulse and states that she has been worrying and stressing for a long period of time and has been having frequent nightmares, which is what is contributing to her illness. In this scene, numerous people have been poisoned, and the doctor is unable to figure out the cause. His friend takes the poison so the doctor can see precisely how the poison affects the body and possibly find a cure for it. He combines questioning with pulse reading, as well as seeing the physical reactions to the poison. Because the patient knows martial arts, he is able to describe exactly where the pain is occurring and where he feels his qi is weakening. The doctor was able to observe that the patient's face was flushed and sweating. Next, he takes the patient's pulse and asks him a couple more questions regarding his eyesight and the trembling of his fingers. Through all these techniques, the doctor was able to figure out that it was mercury poisoning. This scene best describes the sight, question, pulse reading, listening combination usually required to form a good diagnosis in traditional Chinese medicine. These two previous scenes follows pulse reading used in traditional Chinese medicine a lot more closely than dramas usually do.
Pulse reading was also used for determining whether or not a woman was pregnant. In Charlotte Firth's book, A Flourishing Yin, pregnancy is discussed with regards to pulse taking. On page 250, it is said that, quote, "Sometime there was a conflict between a woman's belief about her condition and the doctor's diagnostic evidence using pulse. With the delicate vegetarian wife of Ko Yu-fu, who at 36 was thought past childbearing, Chang astounded her family with a textbook diagnosis of an early second-month pregnancy, based solely on her floating, slippery, and flowing pulses. When her belly gradually swelled and her fetus began to move, then they believed me." End quote. Many Chinese practitioners believe pulse taking to be effective in determining whether or not a female is pregnant. However, there are also times when doctors examine a woman's pulse and give out a false diagnosis. On page 250, it is said that, quote, "Liu Weiyuan's affinal kinswoman appeared to Cheng an unlikely candidate for pregnancy. She was in her 40s, thin and overworked, and coughed a tiny amount of blood. He rejected her self-report that she was 2 months with a child, but later she aborted, and he had to defend himself with the implication that his spleen-restoring formula had caused the miscarriage." End quote.
A lot of historical dramas are set place in palaces. This involves a lot of concubines and the fights between them for power. Of course, diagnosing pregnancy and the effects of sabotaging those pregnancies are commonly portrayed in those dramas. The only form of diagnosing pregnancy seen in dramas is through pulse reading. Not only is it portrayed as extremely accurate, which we know is not the case, it is also portrayed as accurate to the point where the exact number of months in which the woman has been pregnant can be told from the pulse, as well as the health of the fetus and any possible dangers. In this scene, one of the pregnant concubines felt pretty hard in the garden. After the doctor read her pulse, he stated that the pulse and the pregnancy qi are not stable. He recommended that she rests and take some medicine and hopefully will restore pregnancy qi. Through pulse reading, the doctor is also able to tell when the end of the pregnancy is and will be able to prescribe medicine to ensure that the delivery process goes well. In this scene, the concubine is pregnant again after giving birth to twins the previous year. However, during this pregnancy, she has been feeling continuously ill and continuously throwing up. The doctor senses that something is very wrong and recommends that she brings in the older doctor and maybe she will be able to keep her child. Here, the older doctor comes to the palace. After taking her pulse, he tells her that the younger doctor could tell that from the very beginning, her pregnancy qi is a lot weaker than normal and has been using herbal medicine to try to restore it. However, due to her constant stress and the state of her health, as well as the fact that she has now fully recovered from giving birth to the twins, it is not a good time for her to be pregnant, and she will most likely lose the child. She asks him how long she is able to keep the baby, and he states that she has been pregnant for 4 months so far, and that the baby wouldn't be able to make it past month 5. From these scenes, we can see how accurate pulse reading is portrayed in Chinese historical dramas. For people who are not aware of pulse reading in traditional Chinese medicine, it seems like it is the sure way of diagnosing everything, from pregnancies to diseases to poisoning. Though there are some dramas with scenes that portray pulse reading more closely to the way it actually was used than others, the overall message seems to be that it is the only way for doctors to diagnose their patients and that it is extremely accurate to the point where doctors can tell exactly how many months a woman has been pregnant from just the pulse itself. Another interesting note is that a lot of these dramas take place in different time periods. Some are from the Qing, Tang, Song dynasties, some are from the period of Warring States, and some are unknown. However, the method of pulse reading portrayed in these dramas stay pretty much the same. Though diagnosis in traditional Chinese medicine requires numerous methods such as listening, smelling, feeling, looking, and asking, in traditional Chinese dramas, overall only feeling with pulse reading is used. In order to see why, we need to look at the bigger picture. Recently, historical Chinese dramas have become extremely popular. We think that the reason for this is for people who are not experts on Chinese history, the past dynasties and lives of people living in those time periods have a certain mystique and mysteriousness to them. With pulse reading as the only form of diagnosis used in dramas, it adds to that mystique and is more visually pleasing to viewers than, say, if the doctor was smelling the patient or listening to the patient's body. It's used so frequently that now it has become the norm for historical dramas to show it as the sure way of diagnosing patients.